I'm Jody Heymann. I'm Dean of the Fielding School of Public Health, and it's my great pleasure to introduce tonight's moderator, Richard Sinaiko. So Richard really has an extraordinary 4-decade career in healthcare management, and it's been distinguished in so many measures. I'm just going to rattle through a few because we could spend the whole time just talking about all he's accomplished. He spent 11 years at UCLA Medical Center. The last 5, he was the chief financial officer. In 1991, he formed his own healthcare management consulting firm, Sinaiko Healthcare Consulting. They had clients included Blue Cross and Blue Shield of California, Amgen, and many others. The firm was acquired and in 2013 became part of Ultegra Health, a major provider of services for providers and health plans on a national level. Somehow, while doing all of this and much more, including being assistant dean of the USC School of Medicine for faculty practice and ambulatory care, he managed to have a whole series of volunteer and leadership roles. These included, among others, Board of Visitors for the University of Wisconsin School of Nursing, being on the Community Benefit Committee for Cedars-Sinai Medical Center, and serving for the California Dental Association. Most important for us is the fact that he's given us for 20 years so much of his time at the school as a professor, guest lecturer, and advisor for the Department of Health Policy and Management in both the MPH and the executive MPH programs, as well as UCLA Extension. So I'm going to pass it over so you can hear from our phenomenal panel, but I just want to say, his role in leading management in this area and also all of his contributions to the school in this area. To me, there's a particularly personal note, which I haven't shared before with you, Richard, which is, and it's relevant to tonight's panel, which is management of residents and nurses was the difference for me, mismanagement, and then later successful management within about a 48-hour period of almost being killed by the hospital and then being saved. So as any of us who have been in these circumstances know how important tonight's topic is, and I think on a much bigger scale than a personal scale, as our country goes into something, a time where the lives of so many are going to be at stake, we need your skills and we need the wisdom of the panel. So thank you for doing this for us.
I honestly don't know what to say. Thank you, Jody. That's it's all gone by so quickly, too. I'm thrilled to be here. My association with this institution, as you've just heard, has been long-term, and I really owe it a lot for my career and my life here in Los Angeles. I'd like to welcome you to the Paul Torrens Healthcare Forum, UCLA School of Fielding and School of Public Health, and we appreciate everybody being here for one of these monthly sessions. And we try and address current topics that are influencing our healthcare system today. I particularly want to make note of the fact I'm thrilled to have multiple attendees tonight from the UCLA School of Nursing. We have not had the pleasure of your attendance here, and I just want to publicly offer you an open invitation. We have these every month, and we'd love to see you come as often as your other responsibilities will allow. We're very pleased to have 2 outstanding panelists this evening who are on the front lines of the topic for this evening's discussion, involved directly in the training of nurses and residents as they prepare to enter the world of providing medical care. Mary Sue Heilmann is PhD, RN, and Dr. Kate Perkins, who's an MD, PhD. Our format is our panelists will each present for 10 to 12 minutes. We will then open the floor to all of you for any questions you may have, and we have microphones available for you to use when you ask your questions. As I agreed to host this forum and was given this topic, I could not help but think of Dr. Sherman Mellenkopf, who was the long-term dean of the UCLA School of Medicine. Had the privilege of knowing him and working with him for many years. He was the longest-serving dean in the history of American medical schools. Sherm was, in addition to being a gastroenterologist and a medical school administrator, he was also a great philosopher. And every time he would give a presentation, he would somehow be able to work in the line. He hoped that we would all live in interesting times, which is a famous quote from Confucius. So I think for now, for us, this is certainly a time when we are finding ourselves in interesting times as we contemplate where our healthcare system is going and what it will mean for those who devote their lives and careers to providing services to their patients. The changing environment is indeed well on its way, and how it will impact physicians and nurses and all other healthcare professionals, and how it is impacting how they are being prepared to change the environment will be of great interest from our panelists. It will also obviously affect all of us as patients as well. So with that brief introduction, I'd like to introduce first Mary Sue Heilmann. Mary Sue is a PhD RN and is associate professor with the UCLA School of Nursing. Her current research involves the use of transmedia storytelling over multiple digital platforms to improve symptom management related to depression and anxiety among Latinas. Fueled by insight from participants, Dr. Heilmann integrates issues of motivation, resilience, intergenerational cultural expectations, social justice, and gender issues in her work. Dr. Heilmann has also focused on improving the television, the accuracy of portrayals of nurses in film and television. In June 2015, she gave the National Institute of Nursing Research Directors lecture entitled From Silver Screen to the Web, Media Portrayals of Nursing. Based on her threefold area of expertise, media-based interventions, qualitative research, and mental health, Dr. Heilmann is actively refining a new model for nursing science that features transmedia portrayals of nurses as part of powerful and promising interventions with patients, the public, and other professionals. We're also thrilled to have Dr. Kate Perkins. Dr. Perkins is an MD, PhD, and is currently Vice Chair for Education in the UCLA Department of Pediatrics, and also serves as Associate Dean for Graduate Medical Education at the David Geffen School of Medicine at UCLA. She brings to this role her passion for partnership with residents and over 20 years' experience in graduate medical education. Dr. Perkins did her residency in pediatrics at Cedars-Sinai Medical Center after having completed both medical school and PhD training in genetics at the University of Minnesota. Leah Vriesman, I'm sure that makes you proud. She has been recognized over the years with numerous teaching awards at both the undergraduate and graduate medical education levels, including Cedars-Sinai Medical Center Pediatric Residency Golden Apple Teaching Award, the Award for Excellence in Education from the David Geffen School of Medicine, and the UCLA Teaching Humanism Award. Dr. Perkins' scholarly interests lie in the area of medical education, including curriculum design and development, resident evaluation, faculty development, and resident well-being. So with that, I'd like to invite Mary Sue Hayamin to begin.